Hearing loss and tinnitus explained. Hearing loss and tinnitus are common conditions that impact millions of lives. Hearing loss can result from various causes, including age, noise exposure, medication, infections, and genetics. It can lead to communication challenges, strained relationships, decreased quality of life, and even safety concerns. Tinnitus, characterized by ringing or buzzing in the ears, often accompanies hearing loss, but can also have independent causes. Tinnitus can cause psychological distress, sleep disturbances, and impaired concentration. Please watch this video to the end where we will reveal how you and your loved ones can finally break free from hearing loss and tinnitus. Don't forget to give us a thumbs up, subscribe, and turn on notifications so you never miss our videos. Let's get started. Hearing loss. An overview. Hearing loss, also known as hearing impairment or deafness, is a common condition that affects millions of people worldwide. It can occur in one or both ears and can range from mild to profound. Hearing loss can be categorized into three main types based on where the problem originates within the auditory system. 1. Conductive hearing loss. This type of hearing loss occurs when there are issues with sound transmission from the outer or middle ear to the inner ear. Common causes include earwax blockages, ear infections, and problems with the ear canal or eardrum. 2. Sensorineural hearing loss. Sensorineural hearing loss is the most prevalent type and results from damage to the inner ear or the auditory nerve pathways. Aging. Exposure to loud noise, certain medications, and genetic factors can contribute to sensorineural hearing loss. 3. Mixed hearing loss. As the name suggests, mixed hearing loss combines elements of both conductive and sensorineural hearing loss. It occurs when there is damage in both the outer/middle ear and the inner ear or auditory nerve. Tinnitus, the ringing in your ears. Tinnitus is often described as a ringing, buzzing, hissing, or clicking sound in the ears when there is no external sound source. It can be a primary condition or a symptom of an underlying issue, such as hearing loss or an ear injury. Tinnitus can be temporary or chronic, and its severity can vary significantly. Tinnitus can be broadly classified into two types. 1. Subjective tinnitus. This is the most common type of tinnitus and is typically caused by issues within the ear or the auditory nerve. Subjective tinnitus is only audible to the person experiencing it and cannot be heard by others. 2. Objective tinnitus. Objective tinnitus is relatively rare and can be heard by both the affected person and a healthcare provider. It often results from a physical issue, such as a blood vessel disorder or muscle contractions near the ear. Causes of hearing loss. Understanding the causes of hearing loss is crucial in preventing, diagnosing, and treating the condition effectively. Here are some primary factors contributing to hearing loss. 1. Age-related hearing loss, presbycusis. Age-related hearing loss, known as presbycusis, is a natural part of the aging process. It typically begins around the age of 60 and progresses gradually. Presbycusis primarily affects the ability to hear high-pitched sounds and understand speech, especially in noisy environments. 2. Noise-induced hearing loss. Exposure to loud noises, whether in the workplace or recreational activities, can lead to noise-induced hearing loss. Prolonged or intense exposure to loud sounds can damage the delicate hair cells in the inner ear, leading to permanent hearing loss. This type of hearing loss can be preventable through the use of hearing protection, such as earplugs or earmuffs. 3. Ototoxic medications. Certain medications, known as ototoxic drugs, can harm the auditory system and lead to hearing loss. These medications include some antibiotics, chemotherapy drugs, and high doses of aspirin. It's essential to be aware of the potential side effects of medications and discuss any concerns with a healthcare provider. 4. Ear infections. Ear infections, particularly in the middle ear, can cause conductive hearing loss. The buildup of fluid and inflammation in the ear can interfere with sound transmission. Prompt treatment of ear infections can help prevent hearing loss. 5. Earwax blockage. Accumulated earwax can block the ear canal and cause temporary conductive hearing loss. Removing excess earwax is usually a straightforward procedure performed by a healthcare provider. 6. Genetics. Genetic factors can predispose individuals to hearing loss. Some genetic mutations can lead to congenital hearing loss, while others may increase the risk of age-related hearing loss. 7. Trauma or injury. Physical trauma to the head or ear can result in hearing loss. This can include injuries from accidents, falls, or objects penetrating the ear. 8. Diseases and medical conditions. Certain medical conditions, such as diabetes, high blood pressure, and cardiovascular disease, can contribute to hearing loss. Autoimmune diseases and infections like mumps and meningitis can also affect hearing. Effects of hearing loss. Hearing loss can have profound effects on various aspects of an individual's life, including 1. Communication challenges. Hearing loss can make it difficult to engage in conversations, leading to feelings of isolation and frustration. Individuals with hearing loss may become less social and withdraw from social activities. 2. Impact on relationships. Hearing loss can strain relationships with family, friends, and loved ones. Misunderstandings and the need for repeated communication can create tension and affect the quality of interpersonal relationships. 3. Reduced quality of life. Hearing loss can diminish one's overall quality of life. It can lead to feelings of depression, anxiety, and decreased self-esteem. It may also affect cognitive function and increase the risk of cognitive decline. 4. Safety concerns. Hearing loss can compromise safety by making it challenging to hear alarms, sirens, and other warning signals. It can also affect an individual's ability to localize sounds, potentially impacting their awareness of their surroundings. 5. Decreased work performance. In the workplace, hearing loss can hinder communication with colleagues and superiors, potentially leading to decreased job performance and career opportunities. Causes of tinnitus. Tinnitus can be a symptom of various underlying conditions, including 1. Noise exposure. Loud noises, such as those encountered in workplaces with industrial machinery or from recreational activities like concerts, can damage the hair cells in the inner ear and lead to tinnitus. 2. Age-related hearing loss. As hearing naturally declines with age, the risk of developing tinnitus increases. 3. Earwax blockage. A buildup of earwax can cause tinnitus by affecting sound conduction in the ear. 4. Ear infections. Ear infections can cause temporary tinnitus as a result of inflammation and fluid buildup in the ear. 5. Meniere's disease. Meniere's disease is a chronic inner ear condition that can cause tinnitus along with vertigo and hearing loss. 6. Medications. Certain medications, especially high doses of aspirin, can induce tinnitus as a side effect. 7. Ear and head injuries. Trauma to the head or ear can lead to tinnitus, either due to direct injury to the auditory system or associated conditions like temporomandibular joint (TMJ) disorders. 8. Vascular issues. Tinnitus can result from blood vessel disorders such as high blood pressure or turbulent blood flow near the ear. 9. Tumors. In rare cases, tumors, such as acoustic neuromas, can affect the auditory nerve and cause tinnitus. Effects of tinnitus. Tinnitus can have significant effects on an individual's mental and emotional well-being, including 1. Psychological distress. Persistent tinnitus can lead to psychological distress, including anxiety, depression, and irritability. The constant presence of sound in the ears can be mentally exhausting. 2. Sleep disturbances. Tinnitus can interfere with sleep, making it challenging to fall asleep or stay asleep. Sleep deprivation can exacerbate the emotional toll of tinnitus. 3. Impaired concentration. The intrusive nature of tinnitus can make it difficult to concentrate on tasks at work or home. This can affect productivity and cognitive function. 4. Negative impact on relationships. Tinnitus can strain relationships, particularly when the affected individual's mood and behavior are affected by the condition. 5. Reduced quality of life. The combination of physical discomfort and psychological distress can lead to a decreased quality of life. Some individuals may avoid social activities and become increasingly isolated. Conclusion. If you or a loved one are experiencing hearing loss or tinnitus, always seek medical advice and support. Then click the link in the description below to learn about a recent medical breakthrough that is helping thousands of men and women of all ages get rid of their tinnitus and enjoy perfect hearing in record time.